Hello guys, welcome back to RG NCLEX Talks. Today we are mastering ABG interpretations, the topic that scares many NCLEX students, but not after this video. I'm going to break down ABG in the simplest way possible, step by step, and we'll solve some practice questions together exactly like the NCLEX. The questions which I got in my NCLEX and and I will show you how I learn it and how I solve those ones. And I content wise, like you will see a lot of content on YouTube or some other sources, but I will just try to make it easy or simple as much as I can do, so that you guys learn it very quickly and solve the questions, so that next time when you see these questions you will not get scared. And trust me, you just learn these very easily. So here you will see ABG as arterial blood gas, and you have to learn the values, which is like pH value 7.35 to 7.45. You have to learn partial CO2 value, which is 35 to 45, and then HCO3, which is 22 to 28. So CO2, you have to take it all the time as acid. Think CO2 acid or acetic gas. And bicarbonate, think base or alkalotic. So from keep this in mind. And then in exam you will get one rough sheet when you were sitting for exam. So whenever you got ABG question, I suggest you to make in such a way that will help you to solve the question very easily. So make 3 lines. On one line write down pH 7.35 to 7.45, and then you have to make another line which is CO2. There you have to write down 45 on this side and 35 on this side, because pH and CO2 goes vice versa. And it's an easy way to learn it, because pH value is 7.35, whereas and it goes to 7.45. So you just have to learn after the point like 35 and 45. That will make it easy for you. And then you have to go to metabolic. Then you have to go to bicarbonate, which is count as a metabolic, and CO2 is count as a respiratory. So metabolic, as I write down, 22 to 28, and some books will say you 22 to 26. Okay, this is the main thing, right? When you write down this one, trust me, it will make your life very easy. You can solve the question very easily. After this, you don't have to be worry on that. So as I said, pH goes vice versa to CO2. So if pH is down, CO2 will be high, and if pH is high, CO2 will be low. However, it goes hand to hand with bicarbonate. If pH is high, bicarbonate is high. If pH is low, bicarbonate is low. Let's just practice one question now. So first question is, pH is 7.30, CO2 is 49, HCO3 is 25. So if you write as we make the lines above, right? If you see pH is 7.30, so on above you see it comes on acidosis side, right? Then you see CO2 is 49, that comes under acidosis side as well, and then it is not in the normal value. So that means it is respiratory. SCO3 25, which comes under normal value, that means it is normal. So the right way to write down the answer is respiratory acidosis. I hope you understand what I'm trying to say. Next example is pH 7.49, CO2 is 30, and bicarbonate is 25. Here, if you see, 7.49 is comes under alkalosis side, and then CO2 comes under alkalosis side as well. So, but that is respiratory. As I said, CO2 is respiratory, right? So then it count as respiratory alkalosis, because bicarbonate is again in the normal range. I hope you guys getting this. Then I will teach you the another method with the same things as well. As I write down these values, 7.55, CO2 55, SCO3 35. So then you have to see again on which side it come as. That's one of the trick we just did it, and it called as a Rome method, if I'm not wrong. But there is another method I will teach you today, which is tic-tac-toe method. And you can see on the sheet I made that tic-tac-toe method as well. So what you have to do, you have to write down the acid on the one side, you have to write down normal in between, and the base on the other side. As you see the values on this question, 7.55 comes under alkalosis, and alkalosis is base. So we will write pH is under base. Then you see CO2, which is comes under which is acid. As I said, CO2 is a acidic gas. So that comes under acid, and the value comes as under towards acidosis, right? And now if you see the bicarbonate value, which is 35, that comes under alkalosis side, right? So when there is a two values comes under the same, then it comes, that's the answer. So here it's a metabolic alkalosis is the answer. Next is compensation. So there is another thing, when some change happen in the body, our body try to compensate it. So there is three type of compensation: uncompensated, partially compensated, and fully compensated. Uncompensated means when pH is out of range but CO2 and HCO3 is in range. Partially compensated is when pH, CO2, HCO3, all three out of range. So in the first one, pH is in range, pH is in out of range, but CO2 or HCO3 in range. Here, all three out of range, as in above question. And the fully compensated means pH in range. So then you will see one example where pH is 7.28, which comes under towards the acidosis, right? It's not in, it's out of range, right? PaCO2 is 58, which is again out of range. HCO3 in range, which is under 22 to 28. So if you see, if the pH is out of range, CO2 or HCO3 is in range, it count as uncompensated. And if you see the values, 7.28 comes toward acidosis, and CO2 is out of range, so it is respiratory acidosis, uncompensated. Next example, if you see, which is pH 7.48, PaCO 248, HCO 335. Here, if you see and remember those lines, all the three values is out of range, so it's partially compensated. And then you have to see where the two things match, so it's metabolic alkalosis. Then is pH 7.36, PaCO2 is 52, and HCO3 is 32. Here you see the pH is in range, so it's fully compensated. So guys, this is just the trick. You just have to learn it, and trust me, you watch this video again and again, practice some questions, you will be mastered on this. So congratulations, you just mastered ABG interpretation the NCLEX way. ABG don't have to be scary. You just need a system. If you found this helpful, like this video, subscribe and share it with your NCLEX friends. This is RG NCLEX Talks, your guide to simplify tough nursing concept. See you in the next video. So once again, thank you for watching. Myself Raman, I passed my NCLEX RN. And please, as I just started my channel, if you guys support it, and just comment me on what topic you guys want some videos, or I will be more than happy to make it, as I want to whatever I learn it, I want to help somebody else, so that they can succeed or achieve their dreams. Because I know NCLEX is hard, no doubt, but trust me, your hardship